Well, a top vaccine official from the FDA has abruptly resigned after reportedly being told he could either quit or be fired. In his two-page resignation letter to the agency's acting commissioner, Dr. Peter Marks wrote in part this: "It has become clear that truth and transparency are not desired by the secretary, but rather he wishes subservient confirmation of his misinformation and lies." An HHS official releasing a statement saying if Dr. Marks can't get behind the new secretary, then he has not a place at the FDA. Marks is now the third top official to leave the FDA this year. And this all comes as RFK Jr. announced major layoffs at HHS this week. Here he is explaining why those layoffs are necessary.
We have over 100 comms departments. We have 40 procurement departments. We have dozens of IT departments, dozens of HR departments. None of them talk to each other. And what we're trying to do now is to streamline the agency, to eliminate the redundancies, and to focus the mission so that everybody who is at HHS is going to wake up every morning and say, what am I going to do today to make America healthy again? And we're going to make it easier for those. We're not cutting scientists. We're not cutting frontline workers, we're cutting administrators, and we're consolidating the agency to make it more efficient.
He says he's streamlining it, but he's keeping all the worker bees. The department will now operate with 62,000 positions instead of 82,000. Along with the layoffs, there are an additional 10,000 workers who are either taking early retirement or voluntary separation offers. Here with us now is Dr. Mark Hyman, co-founder and chief medical officer of Function Health, as well as the founder of Cleveland Clinic Center for Functional Medicine. You can see him here with Robert F. Kennedy. If you want to go ahead and pop that picture up, we know that you have got Robert F. Kennedy Jr.'s ear. Great to have you on the show. I've been covering a lot of these Maha type stories and really looking forward to this interview. Thanks for being here.
Oh, my pleasure. Thanks for having me.
Are you concerned that we may see other officials step down from other agencies? Do you think more officials should step down from other agencies?
I think what's happening today is actually quite important, which is a reflection of the sprawling bureaucracy that's actually making America sick and costing hundreds of billions, if not trillions of dollars. In 2021, the Government Accountability Report on Nutrition Policies, Chronic Disease, and their Economic Impact found that there were 21 agencies and departments with over 200 policies, often working at cross purposes with each other. For example, the dietary guidelines suggest that people reduce their soda consumption and sugar and junk food, while SNAP within the USDA pays for $125 billion of food stamp program, about 75% of which is junk food, and soda, 10% is soda. And that creates more disease, costing taxpayers more money, hundreds of billions of dollars. And the GAO report from the congressional watchdog recommended the creation of a federal entity to address this. And that's exactly what Robert Kennedy has done. And we now have an agency consolidation, reducing the number of divisions from 28 to 15. And the Administration for Healthy America, or the AHA, is that entity that I hope will be able to consolidate a lot of these policies and work towards creating health rather than more disease.
Dr. Hyman, I've heard you say things like what we have on our hands right now is not a health care system. It is a sick care system. Can you explain that distinction?
Absolutely. I mean, recently, Robert F. Kennedy Jr. talked about the problem of how we think about fixing healthcare, which is reducing entitlements or creating Medicare for all, which doesn't address the fundamental issue, which is why are so many people sick in the first place? Why have we seen disease rates skyrocket over the last 50 years and cripple both the population in terms of their suffering, the economic impact, the social impact, the loss of human capital? Why are we not addressing that? And that is, I think, what is the fundamental problem in government. And that is what's being addressed, I believe, by this new administration. And whether you're Democrat or Republican, I don't think this matters. Health is a human issue. And what we're seeing around the country is really startling. There's over 100 different bills across the country in over 30 different states, including ones put forth by Republicans, Democrats, I think 13 by Republicans, 10 by Democrats, many bipartisan bills to address the problems in our food system, to get rid of food additives, to help address the problems with GRAS, which is the safe sort of determination by the FDA, which is fundamentally flawed. It also is looking at SNAP reform, which is quite important, which is how do we improve our food stamp program, which is meant to create nutrition security, not just food security. And food security is having enough calories, which could be all soda, but nutrition security is having enough nutrients. And most of the obese in this country are actually malnourished. So this is a fundamental shift in our thinking.
That's right. They're eating too much, but they're not good calories, right? And SNAP is for nutrition. It's not for junk food. It
That's
was
right.
never meant to be that way. And I guess the government is not saying you can't buy these things. You just can't buy it with taxpayer dollars. Talk about the rise of type 2 diabetes. You know, we used to call this adult diabetes, right?
Yes.
And now there are a lot of kids and
Yeah.
teenagers who are dealing with this.
Now, I'm old, but not that old. And when I graduated medical school, we had adult onset diabetes and juvenile diabetes. Now we have type 1 and type 2 because little kids were getting type 2 diabetes or adult onset diabetes as young as 2 years old. Now we're seeing liver transplants in 15-year-olds from drinking soda. We're seeing 1 in 4 teenage boys having prediabetes or type 2 diabetes. And the numbers are just escalating every year. It's hard to keep track of how this is increasing and harming our future generations and both their global competitiveness in terms of national security, where 77% of kids can't actually get in the military who apply because they're unfit to fight. And this is a fundamental crisis for our nation that has not been addressed in the national political discourse and is finally being addressed in this administration. And it doesn't matter, again, if you're a Democrat or Republican or independent, this is a human problem. It's not red or blue or purple. It's a human issue.
Yeah, and you know, it is interesting, this artificial food dyes story that I've been following. West Virginia, which is deep red, and then you've got liberal California, they're pushing legislation. In fact, now there's more than 20 states who are considering bans or some sort of legislation on this.
Yeah.
And the West Virginia governor just spoke out about this, becoming the first state in the nation. And also, they are one of the unhealthiest states in the United States, but the first one to ban this. It's going to start with school lunches. Let's go ahead and listen to the governor.
We have to clean up the food. We really do. Let's start with no more dyes and dangerous additives in the schools. Studies show that can lead to issues with hormones and hyperactivity and learning challenges for our kids and even cancer. Our kids deserve better, and now they're going to get it.
I'm going to tell you, I have a 4-year-old and a 7-year-old, and they love things like ring pops and little jelly this and that and all that. And without a doubt, the artificial food dyes are just enticing for kids. It makes them want to eat more of it. But there are a lot of people out there who think RFK is a quack, right? They think that the science is too thin on this. And what is West Virginia doing? People can eat what they want to eat. What do you say to those people?
I think, the government should not be funding or paying for things that are harming the Americans. And when you look at the evidence around these compounds, whether it's red dye number 3 or butyl hydroxytoluene, which is a preservative, these are banned in most other countries, including Europe. Europe has 400 food additives. We have 10,000. And we have regulations that favor the food industry, basically policing themselves. It's like having a kid in school grading his own term paper. Yes, we think this is safe, put it in the food. That's ridiculous. We need to follow a precautionary principle and look at the evidence dispassionately and see what's going on. And I think when you take a hard look at the evidence of what's in our food, it's harming our kids in one way or another. And we could argue about the degree to which it's harming them. But the truth is that there is a real issue. And it's exciting to me that Governor Morrissey has taken lead on this. It's going to create, I think, a cascade of states across the country who are going to follow suit, both in terms of food labeling, in terms of red dyes and other chemicals in food, in terms of SNAP reform. These are fundamental issues that have to be addressed in America if we're going to end the crippling burden of chronic disease, and if we're going to address the economic impact. The U.S. government spends 1 out of every 3 tax dollars on chronic disease. It's 40% of the total government. It's 1 out of $3 of the federal budget, and it's 40% of the entire healthcare bill in America, which is almost $5 trillion, paid for by taxpayers. And we're basically funding a disease creation system at every level. We need to fund a health promotion system. And that's what I think this administration is attempting to do.
Dr. Hyman, we are out of time, so this has to be super quick. But American Beverage, who represents a lot of these beverage companies, non-alcoholic beverages, says that this is going to increase grocery store prices. Will it?
I think they have a whole trope of statements that try to confuse and confound people, but they are acting in nefarious ways. The food industry, for example, has paid $1,000 to different influencers to oppose any change to SNAP. They spent $13 an hour to pay people to attend anti-soda protests. They gave $5 million to save the children which is an incredible organization that actually stopped them from promoting their agenda to promote soda taxes. I'm not saying soda taxes are good or bad, but just looks how nefarious they are. So I would be very sort of cautious and circumspect about any statements from the American Beverage Association, from the Consumer Brand Association, or any of these organizations that represent big food.
And perhaps they'll start investing in recipes with lower sugar counts and lower amounts of these additives. We'll see how things shake out, but RFK is definitely shaking things up. Dr. Mark Hyman, appreciate your time today. Please come back.
Thank you so much. Thank you so much.
Thanks for watching. Go to joinnn.com to find News Nation on your screen. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.